All right, welcome to the Explainer. Look, if you're gearing up for the vascular FRCS Viva, there's one paper you absolutely have to know inside and out, the CLASS trial. It's a classic for a reason, and it comes up all the time. Today, we're going to break it down consultant style so you can walk into that exam and absolutely nail the answer.
Okay, so here's how we're going to tackle this. We've got a 6-part structure, and I want you to think of this not just as our agenda for today, but as your secret weapon for the Viva. This framework is exactly how you should structure your answer to sound clear, polished, and just, really on top of your game.
All right, section 1. So, first things first. Look, any top-tier Viva answer doesn't just jump straight into the results. No, you've got to set the scene. You need to show the examiner you understand the why behind the trial. So what was the big clinical question? Why did we even need the CLASS trial in the first place?
And really, it all boiled down to this one simple question. You have to remember, back in the late 2000s, things like endovenous laser and foam were becoming really popular. I mean, they were the new, less invasive kids on the block compared to traditional surgery. But, and this is the key point you have to make, we were kind of flying blind. We had a bunch of small trials, sure, but there was no big, high-quality head-to-head comparison. We needed a proper, large-scale RCT to figure out the real trade-offs. What was the deal with quality of life? What about complications? And which one actually works the best?
Okay, moving on. Now we're going to get into the nuts and bolts of the trial design. And listen, getting this part right is so important. It shows the examiner you didn't just memorize the abstract. It proves you understand the quality of the evidence, which is a huge deal.
So when you're in the exam, your best friend for quickly and clearly summarizing a trial is the PICO framework. It's just perfect for it. For CLASS, it breaks down like this. The population, we're talking about 798 patients with primary symptomatic varicose veins. The interventions were endovenous laser and foam sclerotherapy. The comparator? Good old-fashioned surgery, ligation and stripping. And the outcome, the primary outcome, was quality of life at 6 months. Now, you want to add a little extra polish to your answer, something that makes you sound like you've really dug in. Mention a couple of the inclusion and exclusion criteria. It's a great touch. For example, you could say they included patients with CAP class 2 or higher, but, and this is a really good point to make, they excluded patients with really small or really large saphenous veins. That's a key detail, right? It tells you something about who these results really apply to.
Okay, listen up. This is non-negotiable. You have to mention the primary endpoint by name. It was the Aberdeen Varicose Veins Questionnaire, the AVVQ. And don't just say the name, take a second to explain what it is. Show them you know your stuff. Just say, it's a validated, disease-specific quality of life tool, and remember, a higher score is worse. Knowing that little detail is absolutely critical when we get to the results.
All right, here we go. This is the big one, the key results. And let me be clear, this is where you can really shine. Or, well, not. You can't be vague here. You need to be confident, you need to be precise, and most importantly, you have to know the numbers.
So let's start with the main headline, the primary outcome. What happened with the AVVQ scores at 6 months? Well, the foam group, they did worse than the surgery group. It was statistically significant, with a difference of about 1.7 points and a p-value of 0.006. Now, laser versus surgery? No significant difference there. So foam was statistically inferior, but you should also add that the clinical significance of a 1.7-point difference, well, that's a whole other debate, and it's a smart point to raise.
Okay, now let's talk about complications. And honestly, this is one of the most important takeaways from the entire trial. Just look at this. Laser was the clear winner. It's not even close. The complication rate was just 1%. 1. Compare that to foam at over 6%. And surgery at over 7%. That's a massive, highly significant difference. But then you look at technical success, and the story completely flips. This is so interesting. For laser and surgery, the GSV ablation rate was great, over 83% for both, basically identical. But foam? Whoa, It was way, way lower, down at around 55%. So this is a fantastic point to bring up in your Viva. You can ask rhetorically, isn't it fascinating that the technical success for foam was so much worse, but the quality of life outcome was only a little bit different? That shows you're thinking deeply about the data.
Okay, great. So you've laid out the methods, you've given the key results with the numbers, you're doing well. But if you want to move from a pass to an excellent pass, you have to critique the paper. This is what shows the examiner that you're not just a registrar reciting facts. You're thinking like a consultant.
And you don't need to go crazy here. You don't need a laundry list of limitations. Just pick one or two of the big ones. The really obvious ones are, they couldn't blind anyone, which makes sense. The follow-up was pretty short, at just 6 months. And a big one, they didn't include radiofrequency ablation. Just dropping one or two of those into your answer is such a simple, powerful way to show you can critically appraise a paper. Right? We're on the home stretch. This is the final, crucial piece of the puzzle. It's the so what question. You've got all this data. What did it actually mean for patients sitting in our clinics? How did it change what we do every day? Answering this is what turns a good answer into a truly great one. So what's the bottom line? The class trial was huge because it finally gave us that high-level evidence to really understand the trade-offs. It basically said, look, all 3 of these treatments improve quality of life, but they're not the same. It showed that laser is safer with way fewer complications. And it showed that foam just isn't as good at closing the vein. And that evidence, it went straight into the NICE guidelines and pretty much cemented endothermal ablation like laser as the first-line treatment we use today.
Okay, deep breath. Let's put it all together. We've gone through the why, the how, the what they found, and the so what. Now let's crystallize all of that into the perfect, polished, Viva-ready answer. Seriously, think of this as your recipe for success, your 5-step blueprint. You hit these points in this order, and your answer will be logical, it will be complete, and you won't miss anything important. It just keeps you on track and shows that you have a structured, consultant level of thinking, and that is exactly what they want to see.
So, picture this. You're in the Viva. The examiner leans forward and says, "Tell me about the class trial." You take a second. You take a breath. You organize your thoughts using that structure we just talked about. And then you begin. Okay, here's the safe consultant answer. The class trial was a large, multi-center, UK-based RCT published in the NJM in 2014, and it compared foam, laser, and surgery for varicose veins. Its primary endpoint was quality of life at 6 months. Now, it found that while all the treatments were effective, foam actually resulted in a statistically worse disease-specific quality of life compared to surgery. But crucially, laser had the lowest complication rate at just 1%, while foam had the lowest GSV ablation rate at 55%. The study was, of course, limited by a lack of blinding and its short-term follow-up. Ultimately, its findings were pivotal in shaping NICE guidelines, confirming endothermal ablation as a first-line treatment because of its excellent balance of efficacy and low complication profile. You see? You deliver an answer like that, it's concise, it's packed with the right details, it hits every single key point, and the examiner has zero doubt. They know you're ready, they know you're thinking at the level of a day 1 consultant, and that, my friends, is how you nail this question and pass the Viva.